your response to the very strong comments today from the Chief Health Officers in Queensland and New South Wales in terms of making AstraZeneca available to the under 40s?
Look, I respect all of the different views around the country. Critically, what we've done is continue to follow the medical advice, and the medical advice from ATAGI, which is the Australian Technical Advisory Group on Immunisation, is that AstraZeneca is preferred for over 60s, that Pfizer is preferred for under 60s, but I think it is important to actually quote ATAGI, and just to provide the context, ATAGI's advice is COVID-19 vaccine AstraZeneca can be used in adults aged under 60 years of age for whom Pfizer is not available. The benefits are likely to outweigh the risks for that individual, and the person has made an informed decision based on an understanding of the risks and benefits. So there's no change in the medical advice. That continues to be our guide. What has changed is to make sure that we have medical indemnity available for the doctors and the program availability where individuals seek under those conditions. But our approach has always been to follow the medical advice, and that ATAGI medical advice is clear. It's set out, and as you know, we have made some difficult decisions to ensure that that medical advice has been followed. And I'd note that Queensland, and I thank them for this, is continuing to administer through the Queensland health programs AstraZeneca. I believe it's 89,000 doses of AstraZeneca, I'm advised by the vaccine rollout program, have been administered by Queensland Health, and they continue to do that.
So they're now actively discouraging AstraZeneca for that cohort. How does that affect public confidence in the vaccination program?
Well, I think the medical advice, and I have complete respect for all involved here, the medical advice has been clear, and I've stood twice in the Parliament House briefing room alongside the Chief Medical Officer and Professor Brendan Murphy, and either the Prime Minister in one case or Lieutenant General Fruin in another, and outlined that the ATAGI medical advice is first for over 50s and then for over 60s, that AstraZeneca is preferred for over 60s and Pfizer is preferred for over 50s. I'll just wait for 1 second.
Level 1, Banksia. Cogrey, North Building, Level 1, Banksia.
So no change in that medical advice. That has been and continues to be the case. It continues to be the guiding light. But what we have done is recognise that the doctors themselves have been seeking indemnity, and that's been confirmed again today by the Expenditure Review Committee. The Prime Minister has asked me to confirm that that is proceeding, that's in place, that's been endorsed, and so I think that's important, that what has been the ATAGI advice continues to be the ATAGI advice, and ATAGI advice has always contemplated that where an individual had informed consent, they may elect to do so. But our statement on preferred is unchanged, and that remains exactly as ATAGI set out.
If a person is perfectly healthy and under 40 and they want to get the AstraZeneca vaccine, when they go and make a booking at a doctor, should they expect to receive the vaccine?
Well, I certainly would never step between a patient and a doctor. That has always been my principle throughout my time in this role. The medical advice, which has been accepted and implemented by the government, is that ATAGI says that AstraZeneca is preferred for over 60s, Pfizer is preferred for under 60s, and I've just read out ATAGI's actual advice about informed consent.
So if Pfizer is the preferred vaccine for under 40s, why would the Prime Minister then make announcements encouraging people to talk to their doctors about AstraZeneca? Just seems to be a bit contradictory, right?
Well, I would note that Queensland Health is continuing to administer, I think, 89,000 doses, and that they have administered around Australia, 4.7 million doses. Around the world, over 500 million doses. It's been the backbone of the UK program. And we were just discussing before that, in fact, all of us, the four of us, have all received the AstraZeneca vaccine. And so it's an important part. It's an important part of our national armoury, and the advice remains very clear that AstraZeneca is preferred for the over 60s, Pfizer is preferred for the under 60s, and the ATAGI advice, as I've set out, about informed consent is exactly what has been reaffirmed, but that actually has been their advice throughout, and that remains unchanged.